happy afternoon, a very good afternoon. I hope and I believe all of you are doing well. A quick note, everyone. Am I audible and visible, everyone? Yes, I think all of you can hear me and see me. That's great. So I hope all of you are doing well, guys, and your preparation is going on well. So to add on to your preparation and to give you that extra edge, here we are with the LRR session. So today we are going to discuss all the important images, the points in radiology that you definitely should be knowing in radiology, right? This covers majority of your previous year questions and the images as well, plus the potential images that can be asked in the upcoming exam. This session is for all the exams, be it NEET PG, be it INI-CET, be it FMGE, right? So let's decode the black and white of radiology here. And how long the session will be? It's basically, not time bound, but it is, more of syllabus bound. So I'll try to cover everything important. Sania, don't worry on that front. Thank you so much. Alam Noor means a lot. And you would get the PDF, guys, on the PrepLadder app. Right, if you go to the video section, there at the last you would see LRR, and there you would get the PDF post session. It would be available there. Thank you so much, Vijendra. Much better now, right? Okay. So yes, definitely. Thank you so much, everyone. Without any further delay, let's start the discussion. And a quick update for everyone. The INI-CET Champions exam is live since yesterday from 23rd to 27th of April. So make sure you are not missing out on this chance to assess your preparation, because this is very much like the real exam. Plus, most important, it's open to all, it's free. So, everybody can give this champions test, and you can look for how you are actually performing, because it's actually like INI-CET exam divided into sections, and time bound sections are there. So make sure you make the best of this opportunity, because this champions exam is based on the latest INI-CET pattern. Plus you have the audio explanations, right? So you will get a quick glimpse into the audio Q bank that we have. So the audio explanations are there, right? There are a lot of clinical image based questions. So right, so till 27th it is going to be okay, till 27th it is live. So make sure you give the test before that. Okay. All right, so let's start with the discussion, guys. So like we divide our subject into the various systems. First, in radiology, what is important is to understand how to identify the investigation, whether it's a CT, it's a MR, right? Generally, if you see in your exam, there's a question on investigations, and radio anatomy is something which is very important. So we'll start with that. So if I label this image as A and B, tell me what is this image A and what is the image B? Is it CT, MR, MR, CT, both CT, both MR? What is it? Yes. Very good. Right. So remember that first most important thing is, because in the exam hall we tend to make mistake here as well. The first image is CT, the second image is MRI. How do you identify that? Is always look at the bone cortex, the lining of the bone. Okay, so if the bone cortex is white, it's a CT. This is the bone cortex here, it is black, it is MRI. Okay, so do not look at the inside of the bone, right? The bone marrow is black or white. Look at the bone cortex. If the cortex is white, it is CT. If the cortex is black, it's going to be MRI. Okay, first important point. Going to next one, look at this image. Is this a CT or a MRI? Here again, the bone is white. This is CT. And look at these images here. These are MRI. These are not CT. Do not get confused by the white outline. The white outline here, that is not the bone there. Okay, that's not the bone there. That's the scalp fat. Okay, the white that you are seeing there is the scalp fat. Brain ke just bahar, you can see the black outline. That is what is the bone is black. This is why this is MRI. Okay, so never just look at the outer white thing. If outside the brain parenchyma you are seeing the black bone, right, then it is MRI. Now, how do you identify the MRI sequences? Very, very important, right? We have discussed in our videos as well. First thing is you look at the water. If the water is white, it is T2. What is the water in the brain? CSF. So remember T2, the CSF water is going to be white. World War II. Where do you see the CSF? In the ventricles, in the sulcal spaces. That is the CSF there. If the water is not white, then you look for white matter. White matter like corpus callosum, internal capsule, subcortical white matter, right? This is the corpus callosum here. This is the internal capsule here, right? The subcortical white matter. So the white matter is white. That means white matter white, gray matter gray. The anatomy is followed. Remember, this is T1. Anatomy is first year subject. It is T1. Okay. So remember, in the T1, the white matter is white. In flare, it is all black. That means the water is also black and the white matter is also black. So you see the water also black, the white matter also black. It's going to be flare, right? So one of the question which is asked is for brain edema. Okay, if you want to see edema in the brain, what MRI sequence will help there? If you want to see brain edema, what MRI sequence will help there if you want to see the brain edema? Very good. Remember, flare is the sequence. Why? Because in flare, the edema is pathological fluid that appears white. The normal water CSF is becoming black, but the edema becomes white. So rest everything is black. The edema will stand out in the black background. Remember, it is flare which helps you to pick up the pathologies in the brain, right? Now look at the next image here, image A and image B. Both CT, both MR. What do you think? What is this image showing? Yes, image A, image B. What is it showing? Very good. Both are CT. Okay, both are CT. You can see the white bone here, the white bone here, both are CT. What is the difference in between the two is? Correct. Look at this rounded structure, the aorta in front of the vertebra, the aorta in front of the vertebra. Gray aorta is non-contrast CT, white aorta is contrast enhanced CT, right? So contrast in CT is given IV, it goes into the blood, it goes into the aorta and all the vessels. So aorta becomes white in contrast enhanced CT because of what contrast do we use here? Iodinated contrast, okay? What contrast is used in CT? Iodinated contrast. Any X-ray based modality you want contrast, you will give iodinated contrast, okay? This is a contrast enhanced CT, okay? Going to the next one, coming to the concept of Hounsfield units, the HU scale or the HU value which is used in what investigation? CT, right? After the name of Godfrey Hounsfield, we have Hounsfield units in CT. So remember that your recent INI-CET exam question, what substance has HU value of 0? What substance has HU value of 0? Very good, right? This is your recent INI-CET exam question. So remember, water is what is given HU value of 0. Whatever is less dense than water, it is a negative HU value. Whatever is more dense, it's a positive HU value. So another important question, what substances have negative HU value? What substances have negative HU value? Very good. Remember, air and also fat. Fat is less dense than water, not more dense, right? Fat is like oil, less dense than water. So air and fat have negative HU value. Your recent NEET PG 24 exam question, an image of CT was given and on there the HU value was mentioned as HU value hai iska -60. Okay, so what does that indicate? HU value of -60 indicates it is fat containing, right? So the answer was it's a mediastinal mass containing fat. Okay, mediastinal mass containing fat. Okay, so -50 to -100 is fat. Air is going to be more negative. -1000. Water is going to be 0. Okay, water is going to be 0. Is this clear with everyone? Right. Now, this is your next image. Tell me, what do you think is the diagnosis here? I'll give you a clue that this is an ovarian mass. So, what ovarian mass, ovarian tumor can you think of here? This is not the renal one. This is ovarian one. Tell me, what do you think can be the diagnosis here? What ovarian mass is this? Very good, Dr. Vedguru. Why dermoid? Dermoid or teratoma? This is ovarian dermoid, ovarian teratoma. Why? Because you can see the white calcification which is present here. You can see some dirty black areas also. It can contain fat and calcification. So, a mass containing fat and calcification, you should think of teratoma. Okay, it can occur in the mediastinum also, in the ovary also, in the sacrococcygeal teratoma as well, right? So, fat and calcification, it's a teratoma. Okay, it's a dermoid. Going to next one, identify the MRI sequence. What is it? So, in the MRI sequence, where you are not able to differentiate like the gray matter, white matter a lot, but you are seeing those deoxygenated blood containing veins, plus you are seeing this tiny black areas, all these are representing hemorrhage. This is SWI, susceptibility weighted imaging. SWI, susceptibility weighted imaging, is a sequence which is done for hemorrhage. It also helps you to identify calcification. Right, this is a sequence which can help you differentiate hemorrhage from calcification in MRI. Okay, you can differentiate the two on SWI. You will see those black areas. Okay, correct. Going to next one. First of all, tell me what is this investigation which is shown here? What is this investigation which is shown here? Very good. ERCP, right? So remember that the image A is also ERCP, the image B is also ERCP. Why the first image is appearing black and the second is showing white? Because remember that this is ERCP is done under X-ray. It's a video X-ray like fluoroscopy. And in fluoroscopy, you can have the image which is black or you can have the image which is white as well. ठीक है, दोनों दिख सकता है, जैसे DSA में होता है, which is again fluoroscopy. Vessel black भी दिख सकता है, vessel white भी दिख सकता है. Okay, so both A and B are ERCP. Remember, it's a video X-ray. So does it have radiation exposure? Yes, it has radiation exposure. Okay. Next one. So what is this one here? You see the CBD, you see the pancreatic duct, but there is no endoscope there. This is going to be MRCP. Okay, MRCP. What is this white in the MRCP? Is it the contrast that we have injected into the ducts? No, it is the water, right? The bile, the pancreatic juice, which is appearing white, because remember MRCP is a T2 weighted MRI, right? You do not put the dye into the ducts. You put the dye into the ducts in ERCP, right? It requires contrast. Okay, it's a contrast X-ray. While MRCP does not require a dye to be put into the ducts. Okay, clear with everyone? Going to the next one. What is this orange color image asked frequently in the exam? This is white bone CT. If you see a image which is orange CT like this, it is a PET CT. PET combined with CT. An example of hybrid or fusion imaging which is done for right, the cancer staging. Right, so remember this is PET CT. Okay, this is PET CT. And what is the radioisotope that you use in PET? Positron emission. So which is the positron emitter? F18. Okay, it is F18 which is the radioisotope used in PET. Again, a frequently asked question. What is this image here, guys? What is the next image here? Now this is the routine black and white ultrasound. Along with that, you are seeing a orange colored ultrasound image. So orange CT is PET CT. Orange USD is not PET USD. What is the orange USD? Very good, Dr. D. Becky. It is a contrast USD. Okay, it is a contrast enhanced ultrasound. It's a contrast USD. It is contrast enhanced ultrasound. Okay. So remember, the orange colored ultrasound is a contrast enhanced ultrasound, one of your recent INI-CET exam question. What is the advantage of ultrasound contrast over CT contrast and MRI contrast? Recent exam question. What is the advantage of ultrasound contrast over CT and MRI contrast? Very good, Deepak. Correct. It is correct, Yash. It can be given in renal failure also. Why? Because the contrast used here is microbubbles which are excreted via the lungs, and that is why this is safe in renal failure. Okay, that is why it is safe in renal failure. Okay, so this is the question asked, which contrast can you give safely in renal failure? Ultrasound contrast. Okay, it is excreted by the lungs. Sonovist, Sonoview, that's the brand name of the ultrasound contrast. Going to the next one. Look at this image here. What is this investigation here, guys? What is this investigation here? You can see centimeters per second, velocity लिखी हुई है, blood flow वाली ये Doppler है. Okay, this investigation here is Doppler that you are seeing here. Is this a Doppler image, this one? Is this a Doppler image that you are seeing here? Right, if you tell me that the image is blurred, this sort of images is what you get in the real exam as well. Here, it is not the centimeters per second, it is kilopascals written here, right? So, measuring the deformity, the elasticity, the fibrosis in the tissue or the lesion, this is what is called as elastography. Okay, this is elastography, which will also show you color like this. So, remember, any colorful ultrasound image is not Doppler. Okay, if it is showing you the blood flow, it is Doppler. If it is the kilopascals kPa, the strain, the elasticity, that is elastography. Okay, remember that is elastography. Okay, clear with everyone? So, elastography is done in thyroid nodules, in breast lesion, right, liver lesions, वगैरह, basically to see whether the lesion is benign or malignant. Malignant lesions are generally hard, so it helps you to identify whether the lesion is soft or the lesion is hard. Okay. All right, going to next one. This is Doppler, right? And this is also Doppler. This image is showing you the difference between the femoral artery and femoral vein Doppler, that is arterial Doppler versus venous Doppler. Look at the waveform. This waveform here is called as triphasic waveform. Okay, so triphasic waveform indicates this is arterial waveform, right? And a venous waveform is something which is monophasic and it shows respiratory phasicity. Okay, it varies with respiration, inspiration, expiration के साथ वो vary करेगा. So this is a venous Doppler. Okay, this is a venous Doppler. The respiratory phasicity is present in venous Doppler. Okay, it is monophasic. Correct. Going to next one. What investigation is this one here? What investigation is this? Is it X-ray, CT, MR, non-contrast CT, contrast enhanced CT, or is it something else? CT hai, very good. Is it a routine CT, guys? Is it a routine CT, routine non-contrast CT? Or you see something different here? Very good. I've got the answers here. Dhwani, Nishta, Medico K, correct. Now, this is something called as CT cisternogram, a potential image for your exam. CT cisternogram, this is called as CT cisternography, CT cisternogram. Why this is not a routine CT? Because look at the ventricle here, look at the CSF, look at the CSF. How is CSF on CT normally? It is grey color, water is grey. Okay, how is the CSF here? The CSF is white, telling you that it is the contrast present in the CSF, right? So what do we do is lumbar puncture करके contrast डालते हैं in the subarachnoid space, that is CSF. We give head low position and the contrast goes into the CSF. What is it done for? What is it done for? Absolutely right. This is done for CSF leak. Like there is CSF rhinorrhea, CSF otorrhea. कहाँ से leak हो रहा है? To localize the site of leak, we do this CT cisternogram. Okay, we do this CT cisternogram. Clear with everyone? Hi, good afternoon, Rumisha, everybody. Where can you get the PDF in the PrepLadder app post session? Okay. All right. So that was about, summarizing up all the investigations that are frequently asked in your exam, right? We have added the ones which are potential for your exam, like elastography and CT cisternogram. Remember, these are your potential exam questions. Going to now important radio anatomy. CT abdomen में structures identify करना है. So first of all, tell me what do you think is this structure here? Yes, everybody, what is this structure here that you are seeing? Okay, I'll give you the options. Is it stomach? Is it spleen? Is it kidney? Is it gallbladder? Right, the fourth option is gallbladder. See, now understand guys that when you are in the exam hall, you will not know answers to all the questions. You have to connect all the dots, whatever knowledge pieces you have here and there, like a puzzle pieces there, you have to connect all of them and come to the answer. So think logically. This structure which you are seeing here, first of all, it is gray and it has some jet black areas also. What does jet black on CT represent? It represents air. What does gray represent? Water, fluid. So logically thinking ये क्या होगा जिसमें air भी है और fluid भी है? It is going to be GIT वाला structure. This is going to be stomach. Okay, this is going to be stomach. This is the left side of the patient. Gallbladder नहीं होगा. Gallbladder right side में होगा. You will not see air and fluid in the spleen. This is the spleen here behind the stomach on the left side. ठीक है, kidney again is a solid organ. So remember, this is stomach here. If you look very carefully, there are those rugae of the stomach also that you can see here. Okay, so air fluid containing on the left side, it's going to be stomach. This one on the right side is the liver. This one on the left side is spleen. Okay, that is spleen. Can you tell me what is this structure here? Is the spleen here? No, because you can see कि ये bilateral symmetrical वाला कोई organ है, right? So this is the right kidney or left kidney. This is your right but patient's left. This is left kidney and this is right kidney. This is the spleen here. This is the liver here and this air or rugae wala, this is going to be the stomach here. Okay, this is going to be stomach. Is this clear with everyone? Two more important things here in this image. What is this structure here? Let's see who gets this right. What do you think is this structure here? Okay, good question, Sanya. Why does kidney look so bright? See, because all the contrast is going via the kidney. So kidney is the organ which is excreting the contrast. The contrast is getting concentrated there. And that is why kidney will look like more white as compared to the rest of the organs. When the other organs are removing the contrast from there, the kidney is accumulating it. Very good. You guys are amazing. This is IVC here. Okay, very good. This is IVC. This one here is the aorta in front of the vertebra to the left and to the right of the aorta. This is going to be IVC. Remember, in the abdomen we have IVC, not SVC. Okay, this is the IVC that you are seeing. And this is the portal vein going into the liver there. That is the portal vein that you are seeing. Okay, clear with everyone? Right. सांप वाला शुभम वो ऊपर आएगा, ठीक है, बेसिकली चेस्ट में. ये आ गया आपका सांप वाला रिलेशन. ठीक है, वेरी वेरी इंपॉर्टेंट. 1 2 3 4 5 6. Now remember, in the chest, the three major vessels from right to left, the mnemonic is SAP. Okay, right to left कौन आता है? SAP आता है. So it is superior vena cava. AA stands for ascending aorta and P stands for pulmonary artery. You can see the pulmonary artery dividing into right and left. What is 5? What is 6? This is jet black air containing bronchus. Trachea होता तो वो एक ही रहता है. It has already divided into two, right? So this is the left bronchus and this is the right bronchus here. Okay, the left bronchus and the right bronchus that you are seeing. What is this structure labeled 4? In front of the vertebra, this is the aorta. What aorta? Descending aorta. Okay, the descending thoracic aorta, which is in the posterior mediastinum. Okay, which is in the posterior mediastinum. ठीक है, clear with everyone? Right. Going to the next one. This was asked in the recent exam. What do you think is this structure here? What do you think is this structure here, guys? Very good. The one which is like an arch, right? It is arching. This is the arch of aorta. And what is this structure here? Jet black air containing in the middle. It's only the one structure. This is trachea. This is not esophagus. Esophagus is going to be behind, right? Chota sa air speck dikh raha hai. Esophagus is generally collapsed. It is not distended with air like trachea. Okay, it is generally collapsed. And what is this structure here? To the right of the aorta. You know that uska vein hoga. Chest mein kaun sa vein aayega? Superior vena cava. Okay, this is superior vena cava. This is the arch of aorta. Okay, superior vena cava, arch of aorta. And what is this which is going and it will drain into the superior vena cava? This is where you will have azygous vein. Okay, a zygous vein draining into the superior vena cava. Okay, that is azygous vein. Right, this was asked. Now look at this. Again, this was asked in the recent INI-CET exam. Can someone tell me what is abnormal in this image here? What is abnormal in this image here? This is the trachea, this is the arch of aorta here, and you are seeing a branch coming from the arch of aorta going in front of the vertebra. What is that? Very good. Arsa. Okay, this is what you are seeing is arsa. Aberrant right subclavian artery which goes behind trachea, esophagus, that is arsa, aberrant right subclavian artery. How will you identify? There are 4 branches coming from the arch of aorta. Normally there are 3, right? So right subclavian hota hai, ye wala left subclavian hoga, right? So remember the 4 branches that you have is first are the 2 common carotids, then the subclavian, and then the right subclavian is the last branch. So right common carotid, left subclavian, and the right subclavian coming as the leftmost branch, coming in front of the vertebra. Okay, so remember you have the 2 carotids and then the 2 subclavian. So there are 4 branches coming from the aorta. This was the image asked in recent INI-CET exam. Okay, clear with everyone? ध्वनि डबल एओर्टिक आर्च में 2 एओर्टिक आर्च बेसिकली दिखेंगे. I'll maybe share an image with you on Telegram as well to show you that. Correct. Going to next one, identifying the heart chambers. Very, very important. How do you identify them? The anterior most one is the right ventricle, and the posterior most one, if you come from behind, right ventricle ka ulta kar do, that becomes the left atrium. Okay, so the posterior most one is the left atrium. Now this is the midline of the heart. So to the left of the heart basically are the right sided chambers. It's your left but patient ka right. So the structure labeled 2, that is going to be right atrium. If this is left atrium, this is going to be left ventricle. Okay, this is how you identify the heart chambers on CT. Remember, anterior most right ventricle, posterior most left atrium. Okay, so when the left atrium enlarges, it compresses on the esophagus, it can compress on the aorta like this. Okay, esophageal compression, left atrial enlargement. Next one, somehow in the recent years we have seen that it's a favorite for the examiners to ask the rib counting and identify it as anterior or posterior. So suppose if I ask you a question here, first of all tell me that if I mark an arrow here, this is anterior end or posterior end of the rib. This is anterior or posterior, what do you think? Yes? Very good. It is the posterior end. How do you identify is the posterior end is the one which is seen more clear and it is more horizontal. The rib coming from behind is horizontal. Anteriorly it becomes oblique. The ones which are appearing oblique, these are the anterior ends. Okay, these are all anterior ends and these are all posterior ends. Okay, remember posterior is horizontal, anterior is oblique. Okay, now how do you do the counting here in the ribs? How will you do the counting here? So look at the image here, counting may, it's easy to start counting from the posterior end of the first rib. This is the first rib. This is the second rib. Now be very careful when you are counting the ribs because the first and the second, okay, first or second ka jo posterior end hai wo काफी close आ जाता है. So if you will start counting from here, you can count this as 1, 2, 3, 4 and that will be wrong. Okay, so that is why trace the first rib, trace the second rib, and this is going to be the third rib. Okay, so this is 1, 2, 3, 4, 5, 6, 7. Okay, this is how you will count the ribs. Start counting from the posterior end, then, the anterior end of the first rib. Is this clear with everyone? Disha, pneumomediastinum on X-ray will have that continuous diaphragm sign, right? The thymus will be separated. If it's a child, you would see. Sometimes it can have the subcutaneous emphysema also. You will see the air surrounding the heart, pericardium, and that is why there will be continuous diaphragm sign that will be seen. Okay? Yeah, right. Spinnaker sign. Correct. Right? So, guys, remember that this is how you are going to count the ribs. Is this clear with everyone? Right? And do you see anything in this image here? Do you see anything in this image here? There is one rib that you are seeing which is very patla sa rib. First rib ke bhi idhar se jo aa raha hai. So there is a cervical rib that you are seeing there. Cervical rib can cause the thoracic outlet obstruction. Okay, thoracic outlet obstruction. Going to next one. This is CT or MR. This is MRI with the black bone. Look at the label structures. What are the label structures here? What is this structure that you are seeing here? What is this structure that you are seeing here? Neclarios V sign, Shabdeep, is also in pneumomediastinum. Neclarios V sign is also seen in pneumomediastinum. Very good. This is ACL and this one here is going to be PCL. Again, it has been asked in the INI-CET exam. So, ACL and PCL. ACL goes in front here on the tibia and PCL goes behind. Okay, that is how you identify ACL and PCL. Clear with everyone? Okay, right. And what is this structure that you are seeing here? ऐसा जो triangle जैसा दिखेगा, triangle जैसा, bow tie जैसा appearance, this is going to be meniscus. Okay, this is going to be meniscus. Okay, what is this? This is meniscus. So this is a meniscus which has a bow tie like appearance. This is meniscus in MRI. Okay, so remember meniscus, ligament, they are well seen on MRI. Meniscus is a cartilage. So cartilage, ligament, nerves, for all soft tissues, MRI is a better investigation. Is this clear with everyone? डॉक्टर वेदगुरु देखो कोलैटरल लिगामेंट तो आपको जो मतलब कॉर्नल व्यू होगा ना एपीजे मतलब कॉर्नल सामने से जब देखोगे देन यू विल सी द मीडियल एंड द लैटरल कोलैटरल लिगामेंट वेल दे विल बी बेटर सीन व्हेन यू आर सीइंग फ्रॉम द फ्रंट ओके राइट फर्स्ट क्वेश्चन हियर व्हाट डू यू थिंक इज दिस स्ट्रक्चर हियर what is this structure here? Classical shape in the midline, you know, like this Mickey Mouse shape, heart shape. This is midbrain and not pons. Okay, remember it as midbrain. MI has this Mickey Mouse jaisa shape is midbrain. Okay, that is midbrain that you are seeing there. Next question here is what is the structure labeled 10 in this image? What is the structure labeled 10 here? The 9 is the corpus callosum and the 10 is the fornix. Okay, this is fornix, white matter, very, very important. That is the fornix there. Number 6 is mammillary body. Okay, this is mammillary body in front of the midbrain. Then you have pons, then you have medulla. This is the fourth ventricle. This is the cerebellum. Right, this is where you have the pituitary gland and adjacent to pituitary you have what sinus, the black air containing, that's the sphenoid sinus there. Okay, that's the sphenoid sinus there. Okay, clear with everyone? Correct. MB के आगे MB, midbrain के आगे mammillary body आती है. Right. Okay, tell me what do you think? This is your potential exam question. What do you think is this image showing, guys? Anybody, what is this? Deepak is asking what is 11? Okay, the structure labeled 11 here, this is thalamus. Okay, this one here is thalamus. And the structure labeled 12 is the lateral ventricle. Okay, 11 is thalamus, 12 is lateral ventricle. Okay, good. Somebody has answered this. Very good. Medico K, Noman Siddiqui, correct. This is the azygous lobe or the azygous fissure. ठीक है? So this is what you are seeing is the azygous fissure or the azygous lobe, classically seen in the right upper lobe here. Right, azygous pulls the pleura along it and it appears like a separate fissure. So this is the azygous fissure or the azygous lobe. Remember, it's a normal variant and can be asked in the exam. You can see it is going into the superior vena cava. Okay, so this is azygous fissure. देखो cervical rib नहीं है, अगर वो rib होती तो bone जैसे white दिखती. Look at how the vertebra is appearing here. ठीक है, ये bone नहीं है. This is not a bone here. Okay. Going to next one. What is this one here? This is the frontal sinus that you are seeing here. What is this air cell that you are seeing? Is it anterior most, posterior most? You can see it is anterior most. अभी तक maxillary sinus भी start नहीं हुआ है. ठीक है, तो anterior most ethmoid air cell आगे, सबसे आगे आता है agar nasal. Anterior most ethmoid air cell is agar nasal. Okay, agar nasal. And what is this one? The one which is infraorbital. The one which is infraorbital, this is called as Heller cell. Okay, infraorbital is Heller cell. What are you seeing here? What is this structure here? This is the inferior turbinate. This is the middle turbinate. What is abnormal in the middle turbinate? The bone. What is the bone containing? Black air. So what is this called as pneumatized middle turbinate? Okay. Because of that, the middle turbinate has become like a bulla, expanded like a bulla. So this is called as concha bullosa. Okay. What is this called as? Concha bullosa, air pneumatized middle turbinate. Concha bullosa. One of your INI-CET exam question. Are you seeing concha bullosa here? Is this a concha bullosa? Yes or no? Yes. This is your INI-CET exam question. No. Why? Very good, Khushi. This is superior turbinate. Okay, this is superior turbinate. ये inferior turbinate है, ये middle turbinate है और ये कौन सा turbinate है? ये superior turbinate है. So this is pneumatized superior turbinate, not pneumatized middle turbinate. Okay, don't make a mistake here. This is pneumatization of the superior turbinate. Clear with everyone? So that was about the radio anatomy, guys. A lot of images that we have seen, the ones which are very frequently asked in the exam and the ones which can be asked in your upcoming exam as well. Okay, so revise all of this very well before the exam. The investigations anatomy is something where you generally get image in your exam. ONOD cell, remember Khushi, ONON, it is optic nerve related. वो posterior ethmoid cell है, basically जो आपका optic nerve से related होगा, sphenoid sinus के पास आएगा वो, ठीक है, optic nerve से related है. ONOD is optic nerve. Coming to next important section in radiology, emergency radiology, right, of all the systems, emergency वाले हम साथ में देख लेंगे. So what is the image A showing and what is the image B showing? Both of them are CT, but in the CT, this pathology, this is hypodensity, right? This is hypodense, it is dark, this is hyperdense. Okay, hypodense and hyperdense. So first one is infarct and second one hyperdense is hemorrhagic stroke, right? So ischemic, एक है infarct और एक है hemorrhage. Hemorrhage, remember acute hemorrhage, very, very important, appears white, appears hyperdense on CT. Okay, so acute hemorrhage appears hyperdense on CT because of its increased density. Is this clear with everyone? Right, so first one is infarct, which is very well defined. Hemorrhage is more ill defined. Okay, so infarct and hemorrhage, you should be able to identify that. So if the question is, what is the first investigation that you do in a patient of stroke? What is the answer going to be? First investigation in a patient of stroke is very good. It's non-contrast CT to rule out hemorrhage. क्योंकि अगर hemorrhage है तो हम thrombolysis नहीं कर सकते. And if the question is, what is the most sensitive for acute infarct? Read the question carefully. It is asking most sensitive for acute infarct. Remember, CT can be normal in early infarct. It is DWI MRI, which is the most sensitive for acute infarct. Diffusion weighted imaging is most sensitive for acute infarct. Okay, DWI for infarct, SWI for hemorrhage. Next one, the various hemorrhages, you can see they are appearing white areas. कौन से type के hemorrhage हैं ये quickly? The idli shape, biconvex shape, lentiform shape, this is going to be EDH. The one which is following the brain surface, showing the sickle shape, concavo-convex crescent shape, this is SDH. The one which is showing the white CSF, the white blood in the cistern. So basically the CSF has been replaced by blood. This is subarachnoid hemorrhage. Okay, what is this? This is subarachnoid hemorrhage. One of your recent INI-CET exam question. देखो subarachnoid hemorrhage क्यों होता है? Berry aneurysm rupture से होता है subarachnoid hemorrhage. Question आया था कि what interventional radiological treatment is done for aneurysm? Is it going to be clipping? Is it going to be clipping which is done? Yes, remember it is coiling. Understand the fact that if this is an aneurysm here, if you are doing coiling, you go into the vessel and then you put a coil here. Okay, and if you are doing clipping, clipping is something like, you know, imagine जैसे clothes dry करने के लिए जो clip use करते हैं, you put it from outside. So that is done by a neurosurgeon open surgery में. While a coiling is something which is done endovascular, right? It's a endovascular interventional radiology वाला treatment. ठीक है? Is this clear with everyone? So coiling is endovascular, clipping is surgical, right? SAH presents with worst headache of life. Worst headache of life. Going to next one, classical image. What is this? This is diffuse axonal injury which shows tiny punctate hemorrhages in a patient of trauma who has worsening or poor GCS. CT scan mostly is normal. So classically when you have this history, it's a diffuse axonal injury. Sometimes the CT might show the microhemorrhages. Many times it is normal. So in that case, what investigation helps there? SWI MRI helps there. Okay, SWI MRI helps there in diffuse axonal injury. Next one, recent exam question. INI-CET exam question. What sign is this? This is the Mount Fuji sign. Like the Mount Fuji, you are seeing what in the cranial cavity? That is the jet black air. Okay, so this is the air. So what is the diagnosis? Air in the cranial cavity. This is going to be pneumocephalus. Tension pneumocephalus shows Mount Fuji sign. Tension pneumocephalus shows Mount Fuji sign. Okay. Next one. Now, if this is an ultrasound you have done in a patient of trauma, is this fast positive or fast negative? Is this fast positive or fast negative? How do you know this is fast positive? So, you call it fast positive when the free fluid is present. How do you identify fluid on ultrasound? Is by its black color. So, what are you seeing here is this is a black fluid surrounding the organ in the abdomen. Liver के surrounding वहाँ पे आपको black color का fluid दिख रहा है. So, that is why this is fast positive. Okay, this is fast positive. If the patient is stable, you go ahead and do CECT. If unstable, then you will take the patient for surgery. Okay, so this is fast positive. What is this image showing? Is it showing fast or is it showing e-fast? Is it fast or e-fast? Air versus water on USD. Air appears white on USD, water appears black. This is e-fast because it has been extended for the thoracic cavity. You put the probes on the anterior thoracic wall. So this helps you to look for pneumothorax as well. Pneumothorax, hemothorax, ye bhi dikh jayega. So e-fast is extended fast, which is extended to include the thoracic cavity, the pleural cavity also. In fast, there are only 4 areas. Okay, e-fast mein ye do add ho jate hain. What is the first area looking for in the fast? आप ये एपिगैस्ट्रिक ज़िफिस्टर्नल रीजन में किस लिए देखते हो? बेसिकली वी आर लुकिंग फॉर कार्डियक टेम्पोनाड. Okay, we are looking for cardiac tamponade. Clear with everyone? Right? So this is E fast. Now, out of the image A and image B, which is abnormal, what investigation is this? Ultrasound, M mode of ultrasound. Okay, out of image A and image B, which is abnormal? Very good. B is something which is abnormal. You are seeing that the lower half of the image is similar to the upper half. So this is something called as barcode sign or stratosphere sign, which is seen in pneumothorax. Now, if you look at this image, this is more granular appearance as compared to the upper half. This is called as seashore appearance, which is seen in normal lung. So normal people go to seashore, pneumothorax patients are barred from going to seashore. So pneumothorax is barcode sign. All the flat lines, that is barcode sign, is pneumothorax. Okay. Coming to next one, what emergency is shown here? Very important image. What is this? This white line that you are seeing here is the diaphragm. This is significant air beneath the diaphragm, air under diaphragm. This is pneumoperitoneum. Air under diaphragm, pneumoperitoneum, and in air under diaphragm, pneumoperitoneum. What history is generally given? History of a patient who has had peptic ulcer. ठीक है, पेप्टिक अल्सर परफोरेट होके फिर न्यूमोपेरिटोनियम हो गया तो पेप्टिक अल्सर की हिस्ट्री कॉमनली दी जाती है. And what is this sign shown here in pneumoperitoneum? What is this sign shown here in pneumoperitoneum? This is football sign. Again, has been asked in INI-CET exam. Football sign seen in supine X-ray. When the patient lies down, the air comes beneath the abdomen like a football. And what is this white line that you are seeing here? This is the falciform ligament. Okay, so you also see the ligament signs in pneumoperitoneum. This is the falciform ligament sign, falciform ligament that you are seeing in pneumoperitoneum. Okay, clear with everyone? Football. Okay, right. Next one. First image is showing coin in esophagus or coin in trachea. Easiest way to identify coin esophagus का है कि coin trachea का है. AP view देखो. This is the AP view. This is the AP view. If in the AP view the coin is circle, remember it is esophagus. If in the AP view the coin is like a slit like this, remember this is trachea. Okay, so कैसा दिख रहा है उसके हिसाब से अल्फाबेट याद रखना. Circle esophagus, slit is trachea, and remember उसका opposite होता है lateral view में. जो AP में सर्कल है वो लैटरल में स्लिट है, जो AP में स्लिट है वो लैटरल में सर्कल है. ओके, दैट इज हाउ यू आइडेंटिफाई. इज दिस क्लियर विथ एवरीवन? सर्कल esophagus, slit is trachea. Remember we are talking about AP view, frontal view, okay, not the lateral view. Is this a coin or is this something else? Is this a coin or is this something else? Recent NEET PG exam question, right? You can see the double ring appearance. There are two circles, inner circle and outer circle that you are seeing here. So if you see a double ring or a halo like appearance, remember it is not a coin. It is button battery. Has been asked in both INI-CET and NEET PG exam. It's a button battery. Battery has inner circle and outer circle. Coin में सिर्फ एक ही दिखेगा, ठीक है? So double ring sign is button battery. Recent NEET PG 24 exam question. Right. Remember for button battery, you need to remove it even if asymptomatic because वो alkali fluid बाहर आके बैटरी में से perforation, corrosive है वो perforation कर सकता है. It needs to be removed irrespective whether it is symptomatic or asymptomatic. Right. So that was about the important emergencies. Very important. Now going to the next system, that is thoracic radiology. Before that, tell me, I hope everybody is with me and understanding everything and enjoying the session. This is like, you know, your last minute revision for radiology. Everybody give me a quick thumbs up, right? If everybody is with me. That's great. Glad to see that, you know. So तुम्हारा जोश देख के basically, you know, मेरा जोश भी बढ़ जाता है. Amazing. So keep the josh high, guys. Going on to the next system, that is thoracic radiology. Okay. Tell me, what is the diagnosis here, guys? What do you think is this? Dr. D. Veki, thanks to PrepLadder, right, for that. Rafa is Rafa's, I believe, right? Okay. ये abscess है? हाँ कि नहीं? Is this abscess? Or is this something else? देखो, I understand that this can be confused for abscess, but abscess में क्या होता है? Air fluid level होता है, ठीक है? And how is the air fluid level? It is horizontal. It is not going to be bulging like this. Look at the image here. This is like a cavity, उसके अंदर कुछ है. It's not flat. If it was an abscess, it would be air fluid level horizontal. Rather, what you are seeing here is this black color air like a crescent. This is air crescent sign, recent FMGE exam question. Air crescent sign या monod sign भी बोल सकते हो. This is seen in aspergilloma. Okay, this is seen in aspergilloma fungal ball. टीबी का पेशेंट है, जनरली हिस्ट्री दिया जाता है, टीबी का पेशेंट है, उसमें कैविटी है, फंगल बॉल आके बैठ गया और फिर एयर क्रीसेंट बच जाता है. सो रिमेंबर, दिस इज द एयर क्रीसेंट साइन दैट यू आर सीइंग हियर. एयर क्रीसेंट एस्परजिलोमा. करेक्ट, राइट? हाउ डू यू प्रूव दैट दिस इज अ फंगल बॉल इटसेल्फ इज? सीटी आप प्रोन पोजीशन में करके देखो, राइट? पहले सुपाइन में है, फिर प्रोन में है. The fungal ball is mobile. It will change its position. It will go in the dependent part. Okay. Monod, remember monod is like moon जैसा crescent दिखेगा. So air crescent is also called the monod sign. Okay. Going to next one, what sign has been depicted in this image here? Oh, there's some issue with the video. Now, okay? Okay, I think it's good to go. Right. So, what, very good. What sign is shown here? This is not tree in bud. This is air bronchogram sign. Okay, air bronchogram hai ye, where you are seeing these black, these are the bronchi, which are showing that tree-like pattern basically. In the white lung, you are seeing the black bronchi going. This is air bronchogram, which is seen in any cause of consolidation, right? It could be pneumonia, it could be pulmonary edema, pulmonary hemorrhage. जहाँ पे भी consolidation हो रहा है, lung white हो रहा है, that is where you would see this air bronchogram. It's a sign of intraparenchymal pathology. It tells you that the white area is the lung. It's not outside the lung. So will you see this in pleural effusion? No, because pleural effusion is outside the lung. Will you see it in mediastinal mass? No. Again, because mediastinal mass is outside the lung. This is a previously asked question. It is not seen in pleural effusion or mediastinal mass. Okay? It's the same medics, X-ray ho ya CT. Right? Look at this one, guys. What do you think is this image showing? What do you think is this image showing? Look at the fairly bilateral symmetrical opacities. You see the air bronchogram here as well. This is the bat wing appearance. This is the bat wing appearance of pulmonary edema. Okay, this is the bat wing appearance of pulmonary edema. Bilateral symmetrical होगा, cardiomegaly दिख रही है, telling you it is cardiogenic pulmonary edema. Okay, bat wing appearance. Next one, very, very important, the three pleural pathologies. A, B, C. What are you seeing here? The first one, where you see this meniscus as a curve दिख रहा है, Ellis curve दिख रहा है, blunting of CP angle है, white वाला fluid है. The first one is the pleural effusion, showing the Ellis S curve. The second one, where it's a flat horizontal level, you know that horizontal is air fluid both. So it is hydropneumothorax. Okay, so it is hydropneumothorax showing horizontal level. And in the third, this one which you see very carefully here, this is the collapsed lung, right? And surrounding that, the black area, the entire black area, that is pneumothorax. It appears jet black. There are no vascular markings there. Okay, you will see the collapsed lung towards the heart. This is going to be pneumothorax. Okay, this is going to be pneumothorax. Clear with everyone? Right. So this is how you identify the three pleural pathologies. If I ask you the question that what is most sensitive investigation for pleural effusion, what is the answer going to be? Remember, wherever it is fluid, fluid is U, it is best seen on USG. For fluid, the most sensitive investigation is USG. Going to next one, what is the diagnosis here? Which lobe pathology is this? Image A and image B. And based on what sign, basically you tell what lobe is affected. For fluid, it is USG. Remember, very good, Deepak. Silhouette sign. First one is the middle lobe, the right middle lobe, and the second one is right middle lobe, and the second one is left side में middle lobe नहीं होता है. So remember, corresponding to middle lobe there is lingula. Okay, there is lingula. Lingula is a part of upper lobe, Samita, remember that, not lower lobe. Okay, so when you see an opacity obscuring the right heart border, it is right middle lobe pathology. When you see an opacity obscuring the left heart border, it is lingular pathology. Okay, this is a favorite for the exam again. This is based on Silhouette sign. Okay, this is based on Silhouette sign. So remember, this is not pleural effusion. In pleural effusion, the angle is blunted. Okay, the angle is blunted. This is one of the PYQ again. What do you think is the diagnosis here? This is a lateral chest X-ray showing this classical wedge shape, triangular shape, opacity that is overlying the heart. This is what lobe affected? Classically, this is right middle lobe collapse. Okay, this is right middle lobe collapse, and between the two fissures of the right side, you will have the right middle lobe. Okay, you have the right middle lobe, and between the horizontal and the oblique fissure, in between the two fissures, you have the right middle lobe. This has been asked. Okay, this has been asked in one of the FMGE exams. Going to next one, very important. What do you think is the diagnosis here? If I tell you that this patient has increased calcium levels. Another major clue, increased ACE levels. So what is the diagnosis? Very good. This is sarcoidosis. Okay, sarcoidosis showing bilateral hilar lymph nodes. Okay, bilateral hilar lymph node. Kahin pe bhi dikha. Remember, this is also PYQ. Always you should think of sarcoidosis. Bilateral hilar lymphadenopathy, it is sarcoidosis, very, very important. Okay, very, very important. It is 1, 2, 3 sign. It shows Garland sign, 1, 2, 3 sign, galaxy sign, panda sign on the gallium scan, right? There are multiple signs there. Correct. In sarcoidosis, it shows eggshell calcification of the lymph nodes. When lymph nodes are calcified, they are in the form of eggshell. Eggshell calcification is seen. Okay? No. Going to next one, coming to the various heart appearances. The first one here that you are seeing, the boot shape heart. Where do you see the boot shape heart? It is seen in TOF, right? Tetralogy of Fallot. Why do you see the boot shape heart? Because of RVH, right ventricular hypertrophy. Next one that you are seeing here is, this is the figure of 8, also called as snowman heart, which is seen in TAPVC. What type of TAPVC? Supracardiac TAPVC. Okay, above the heart, it is supracardiac TAPVC, figure of 8 snowman. Next one here that you are seeing in this image is, this is egg on side or egg on string. Okay, so this is egg on side or egg on string appearance, which is seen in TGA, transposition of great arteries. Commonly, you know, the history given is maternal diabetes था, फिर बच्चे में day 1 पे cyanosis हुआ, it is TGA. Okay, that is TGA. When you see a heart which is massively enlarged like this, the right atrium is enlarged, it might fill the entire thorax. It is box-shaped heart which is seen in Epstein's anomaly, and Epstein's anomaly is seen with lithium. Okay, Epstein's is teratogenic effect of lithium. Okay, these are the important heart appearances that you should definitely remember. Going to the next one, guys, tell me what do you think is the diagnosis in this image? What do you think is the diagnosis in this image here? Very good. Medico K has got it correct. See, this is a CT image. This is the white cortex. This is the white cortex of the rib. This is CT. And in the CT surrounding the heart, you can see this white calcification. So this is the pericardial calcification. This is calcific constrictive pericarditis. This is the white calcification, pericardial calcification. This is calcific constrictive pericarditis. This entire thing is the heart containing the contrast. Okay, surrounding that is the calcification, calcific constrictive pericarditis. Okay, clear with everyone? Right. Next one, interesting. Tell me guys, what do you think is the diagnosis here? Anyone, what is this image showing? This is not emphysema, not coarctation of aorta. Very good, Medico K, smart. Right, yes, Devjani. This is hiatus hernia. Correct. Okay, what is this? This is hiatus hernia. Remember, if they give you a description for hiatus hernia, that will be like a retrocardiac. Okay, retrocardiac air fluid level is seen. Why retrocardiac? क्योंकि esophagus आपको पता है हार्ट के पीछे आता है, लेफ्ट एट्रियम के पीछे. So फिर जब स्टमक भी आ रहा है, so you will see this air fluid level retrocardiac. The air fluid level is present here. This is the heart. Okay. Here also you are seeing there is some air fluid level. When you take the lateral X-ray, this is the heart, and behind that retrocardiac air fluid level is what you are seeing. Okay, clear with everyone? This is hiatus hernia. Okay, retrocardiac air fluid level. Clear with everyone? This is not the heart that you are seeing here. It is the air fluid level that you have to focus on. Yes. Okay. Going to next one. What is the first image showing here? And what is the second image showing here? This is for the second one. What is the first image and what is the second image? Very good. The first one is congenital diaphragmatic hernia, where you are not able to see the diaphragm well. There are these lucencies in the thorax, right? These are the bowel loops. This is congenital diaphragmatic hernia. And what is the second one here? What is the second one here? You can see the diaphragm, but there are these cystic spaces in the lung. The cystic spaces in the lung. So what is this one here? This is called as CPAM. Okay. CPAM, पूछा गया था recent exam में. Remember, it is CPAM, congenital pulmonary airway malformation. राइट, एम्ब्रियोलॉजिकली जब डिफेक्ट होता है टर्मिनल ब्रोंक्यूल और उसके स्ट्रक्चर्स डेवलपमेंट में, फिर ऐसे सिस्टिक एरियाज आते हैं. It generally affects one lobe of the lung and it can give you the history of recurrent infections. Recurrent chest infections are seen. So that's a common history given. Remember, this is CPAM. Okay, congenital pulmonary airway malformation. Previously it was called as CCAM. Okay. Yes. So that was about thoracic radiology, the most important images that we have covered. Right, going on to the next one, abdominal radiology. Right, the favorite for the exam. What is this image showing? Yes. Very good. That is achalasia cardia. So what is incorrect? Manometries, confirmatory Chicago classification for achalasia, Heller's myotomy is done. Dysphagia to solids is more. This is incorrect. Remember, the solids with their weight, with their pressure, they'll open the LES. The liquids cannot do that. The dysphagia to liquids is more than solids in achalasia. The gold standard investigation is manometry. Okay, the gold standard investigation is manometry, not the 24-hour pH monitoring. That is done for GERD. pH acid reflux के लिए करते हैं. This is showing this bird beak appearance. The dilated sigmoid esophagus is there. This is achalasia cardia. Next one. What is the first image showing? What is the second image showing? Yes. Very good. First may you are seeing triple bubble. There are 3 bubbles which are there. Second may you are seeing just 2 bubbles. So the first one is jejunal atresia, triple bubble sign. The second one is duodenal atresia, which is showing double bubble sign. Okay. So if there are 2 bubbles, stomach duodenum wala, duodenal atresia. Stomach duodenum jejunum. So jejunum wale mein triple bubble aayega, duodenum wale mein double bubble aayega. Okay. So you have triple bubble and you have double bubble. Okay. Yes. Where do you see the apple peel appearance? That is seen in jejunal atresia. Apple peel is seen in jejunal atresia. Okay. See, so when it is ileal atresia, और नीचे जाओगे तो और bubbles बढ़ जाएंगे. There are going to be multiple bubbles that you will see in ileal atresia. Okay. Right. Now, this was asked in the recent NEET PG exam. An ultrasound image was given like this, but the history was the giveaway there. So, what are you seeing in the ultrasound is this is the liver का part और उसके बाजू में ये जो दिख रहा है ये stomach है. ठीक है? And this is the pylorus of the stomach, which is elongated and which is showing the thickening as well. Okay. So, this is the pylorus showing the thickening along with the elongation. This is IHPS or CHPS, right? Congenital hypertrophic pyloric stenosis. Okay. So, this is the pylorus which is elongated and thickened. What sign do you see on ultrasound? Axial transverse वाले में देखोगे तो it shows inner वाला stenotic lumen and the thickened muscle wall that gives the donut sign or the target sign. Okay, the donut or the target appearance. Okay, and what is the investigation of choice for this condition? Very important question, one of the last year NEET PG exam question. The investigation of choice is ultrasound. It helps you measure the muscle thickness. More than 4 mm it is thickened. It is hypertrophic. Okay, so USD is the investigation of choice. You will see the target or the donut sign. Okay, that is important. It will lead to metabolic alkalosis because there's vomiting, acid going out. So there is metabolic alkalosis. The first management is medical, not surgical. You correct the electrolyte, fluid electrolyte imbalance first rather than doing the surgery first. Okay. Next one, what are you seeing here? The classical coffee bean sign which is seen in sigmoid volvulus. The coffee bean sign in sigmoid volvulus. How do you differentiate it? Yes, very good. Paradoxical aciduria, erythromycin में हो सकता है. How do you differentiate from this one? What is this image showing here? What is this image showing here? Something which is looking like an embryo. है ना? Embryo में जैसे ऐसे ऐसे दिखते हैं. तो embryo में embryo जैसे यहाँ पे the lines representing the hostrations. This is cecal volvulus. Okay, this is cecal volvulus. Remember, cecal volvulus has hostrations present. Sigmoid volvulus does not have hostration present. Sigmoid volvulus has coffee bean sign. Okay, that is coffee bean sign. Next one, what are you seeing here? What is this appearance? There is inner bowel and outer bowel. So this is the target sign of intersusception. Okay, this is the target sign of intersusception. Inner bowel, outer bowel. What is this barium enema finding in intersusception? What is this barium enema finding in intersusception that you are seeing? This is called as claw sign. Okay, so the barium goes up and forms a claw around the intersusceptum. That is the claw sign of intersusception important. Okay, very good. Next one, coming to 3 important gallbladder pathologies. This was asked in one of the recent exam. What are you seeing here? The black fluid containing is the gallbladder, and in the gallbladder there is a fold like thing that you are seeing. What is this called as? ऐसा fold जैसा दिख रहा है, the gallbladder is folding. Very good. This is called as Phrygian cap. Okay, this is called as Phrygian cap, which is just a normal variant, okay, in the shape of the gallbladder. Phrygian cap, which is a normal variant. What are you seeing here? This is black color gallbladder, उसमें कुछ एक ecogenic जैसा है, right? So this is how a gallbladder polyp can look like. How do I differentiate it from a gallbladder stone is, first of all, stone will show shadowing, and polyp is something which is non-mobile. It is attached there in the wall. It does not move. If you ask the patient to turn to left side, it is not going to the other side. It is not changing its position. It is not mobile. Okay, it is not mobile. And when you are seeing this posterior acoustic shadowing present, this is the gallstone. Okay, posterior acoustic shadowing present, this is gallstone. What is the investigation of choice for gallstone? It is ultrasound. Okay, investigation of choice for gallstone is ultrasound, because generally gallstones are non-calcified. Okay, gallstones are not calcified. Correct. Going to next one. This is the biliary tree which is shown here, and the biliary tree, it is showing what appearance here? What is this appearance of the biliary tree that you are seeing here? Yes, very good, very good. Vedehi, Gautam, Prakash, correct. So what is that one that you are seeing? The beaded appearance, right? That is the beaded appearance. And where do you see the beaded appearance? So look at the beaded appearance, the beaded appearance of the biliary tree. So the beaded appearance of the biliary tree, because of the fibrosis, the strictures dilatation. This is seen in primary sclerosing cholangitis. Always remember the association with ulcerative colitis. Always remember the association with ulcerative colitis. Very, very important. Recent exam question. This is MRCP. This is the pancreatic duct. This is the CBD. What is the diagnosis here? In the second image, what is the diagnosis here? Very good, Ashish. Correct. This is basically the CBD, which is showing this fusiform dilatation. This is choledochal cyst. Okay, this is one of the recent exam question. This is choledochal cyst. What type of choledochal cyst? When the extrahepatic CBD is showing fusiform dilatation, this is type 1 choledochal cyst. You have the Todani classification for choledochal cyst. Okay, the CBD is showing the fusiform dilatation. Next one, what do you think is the answer to this one? Okay, so many of you say this is HCC. Why is this HCC? Why do you say this is HCC? Remember, a triple phase CT is what is done for liver lesions, triple phase CT, right? And in the triple phase CT, if you are seeing that in the arterial phase, the lesion is becoming white as compared to the liver, and then it is washing out the contrast, so that in the delayed phase, the lesion is appearing darker than the liver, right? This is classical of HCC. It shows early arterial enhancement. Early arterial enhancement is seen with HCC. Why? Because it is supplied by hepatic artery, which gets the contrast first as compared to portal vein, right? So it shows early arterial enhancement with early washout of contrast as well. And what is this liver lesion here? What is this one here? where you are seeing in the early phase there is peripheral, just nodular enhancement, and then the enhancement is increasing. The enhancement is increasing, right? It is filling up, centripetal filling of contrast, right? This is, देखो ये एप्सेस नहीं है. अगर एप्सेस होता तो एप्सेस में सिर्फ वो वॉल एनहांस होती है, उसके अंदर एनहांसमेंट नहीं होता क्योंकि उसके अंदर पस है. Peripheral, there is this peripheral nodular enhancement and then it is filling up inside. This is classical of hemangioma. Okay, remember this is classical of hemangioma. पहले peripheral nodular और फिर वो fill होते जाता है. Classical of hemangioma, that is what you are seeing here. It is classical of hemangioma. ठीक है? Right, now tell me what is this? Look at the liver lesion, hypodense liver lesion with a thick enhancing wall. This is how a liver abscess is going to be. It just shows peripheral enhancement. Only the wall shows the enhancement, not the inner part. Okay? Can somebody tell me what is this here? White यहाँ पे क्या है? What is this white here? Yes? Stomach. Very good. This structure that you are seeing here is stomach. Why is the stomach white here? पहले तो हमने CT abdomen anatomy में देखा था कि वो black और grey होना चाहिए. ये white क्यों है? Okay, Deepak, I'll come to your question. How to differentiate from hydatid? Very good, Khushi, correct. So the stomach is appearing white here because of the oral contrast. When we do CT abdomen, we give iodinated oral contrast. We ask the patient to drink that. So the gut is filled with the iodinated white contrast. It's the contrast there, iodinated वाला. ठीक है, barium नहीं देते हैं यहाँ, iodinated contrast ही देते हैं. Right, how do you differentiate it from hydatid cyst, abscess? See, first of all, your questions will have the clinical background history. ये amoebic liver abscess में generally first there is dysentery, amoebiasis, okay? तो पहले वो dysentery वाली हिस्ट्री होगी, फिर liver lesion होगा. Hydatid cyst में, right, farmer, cattle वाला, dog वाला हिस्ट्री वहाँ पे होगा. Cyst is thin walled, abscess is thick walled, and hydatid cyst में generally they'll give you the membrane floating वाला image, right? Water lily sign, or they'll give you the calcification in that lesion, right? A calcified liver lesion or water lily sign, that is what is going to be hydatid. Is this clear with everyone? Okay? Yes. Correct. So this is your next image. So now tell me what is the diagnosis here. Look at the images and now tell me what is the diagnosis. So this is what I was talking about, a calcified, white calcified lesion in the liver. This is going to be hydatid. A membrane floating inside the liver lesion. Okay, again this is grey color, it's not jet black, it is grey, water containing. Uske andar membrane floating hai. This is classical of hydatid, water lily sign. It might show the multiple daughter cysts. Within the large cyst, there are multiple daughter cysts. That is also hydatid. Okay, so this is how hydatid will look like. Okay, this is how hydatid will look like. नहीं डॉक्टर डी बेकी, जो कैरोलीज में सेंटर डॉट होता है वो कैल्सिफिकेशन नहीं होता है, वो जो पोर्टल वेन एनहांस हो रही होती है उसका डॉट होता है वो. ओके, सो द सेंट्रल डॉट साइन इज नॉट बिकॉज ऑफ कैल्सिफिकेशन. Okay, next one. Can anybody see any pathology here? Anything you can make out in this radiograph here? Very good, Noor Sultan, correct. There's something white that you are seeing in this area. The white you are seeing in this area in the region of pancreas. This is your recent NEET PG exam question. Okay, बेंज साइन तो आपका मर्सिडीज बेंज गॉलस्टोन में आता है, ठीक है, जो ट्राई रेडिएट एयर होता है. दिस इज पैनक्रियाटिक कैल्सिफिकेशन. रिमेंबर व्हेन देयर इज पैनक्रियाटिक कैल्सिफिकेशन, C for C, always think of chronic pancreatitis. Okay, always think of chronic pancreatitis. Pancreas calcification is chronic pancreatitis. Important to remember that. Last time they gave you a X-ray image. This time they can give you a CT image. So look at this again. यहाँ पे stomach है. Stomach के पीछे ये pancreas है. Look at the calcification and look at this one. This is the ductal dilatation. In chronic pancreatitis, there is ductal dilatation. So calcification plus pancreatic duct dilatation that you are seeing here, this is chronic pancreatitis. Chain of flakes appearance दिखता है. Correct. What is this image showing here? Anything abnormal with the pancreas here? Very good, Prachi. In X-ray, acute pancreatitis, there is colon cutoff sign. There is gasless abdomen. कोलॉन कट ऑफ एक्सरे में दिखेगा आपको, जहां वो स्प्लीनिक फ्लेक्चर के यहां तक जनरली एयर दिखती है, फिर एयर ब्लैक एयर नहीं दिखती है. सॉसेज अपीयरेंस तो इज लाइक यू नो दैट इज एन ऑटोइम्यून पैंक्रियाटाइटिस की स्मूथ दिखता है पैंक्रियास, दैट इज व्हाट इज सॉसेज. दिस इज नॉट सॉसेज. सॉसेज मतलब पैंक्रियास ऐसा एकदम स्मूथ दिखेगा. यहाँ पे तो आपको उसके लॉबुलेशंस दिख रहे हैं. यहाँ पे एबनॉर्मल क्या है कि ये पार्ट ऑफ पैंक्रियास में एनहांसमेंट नहीं हो रहा है. ये नॉर्मल पैंक्रियास ऐसे व्हाइट दिखता है, ये व्हाइट नहीं दिख रहा है. प्लस सराउंडिंग द पैंक्रियास यू कैन सी दिस ग्रे कलर फ्लूइड. So there is peripancreatic fluid. The pancreas looks more bulky pancreas. Remember, this is acute pancreatitis. Acute pancreatitis. There is bulky pancreas with surrounding fluid. There can be non-enhancing areas telling you there is necrotic, okay, necrotizing pancreatitis. So this is acute pancreatitis. One of the NEET PG exam question. Acute pancreatitis, pancreas is bulky. Chronic pancreatitis, pancreas is atrophic. Now in acute pancreatitis, after 4 weeks, you can see this fluid collection with a wall-like thing. This is called as pseudocyst. ठीक है, FMGE exam में 2 बार आया है. This is pseudocyst after 4 weeks. Correct. Okay, particularly in नॉन नेक्रोटाइजिंग पैंक्रेटाइटिस में हम उसको सूडोसिस्ट बोलते हैं. नहीं तो अगर नेक्रोटाइजिंग वाला है तो उसको हम वॉन बोलते हैं, वॉल्ड ऑफ नेक्रोसिस बोलते हैं. ठीक है, so that was about the hepatobiliary pancreatic part that we have seen, right? गॉल ब्लैडर, फिर हमने वो CBD वाले देख लिए थोड़े, फिर लिवर लीजन्स देख लिए, पैंक्रियास देख लिया. नाउ कमिंग टू द रीनल लीजन्स. इमेज A, इमेज B, इमेज C. इसमें क्या क्या दिख रहा है? The first image here, what are you seeing here? ठीक है, सबसे पहले यहाँ पे देखो ये CT वाला है और ये MRI इमेज है. CT में you can see the renal lesions which are showing dirty black appearance. Dirty black appearance. Dirty black on CT is fat. Jet black is air. Dirty black is fat containing angiomyolipoma. Fat is lipoma. Angiomyolipoma. What is this image showing? In T1 weighted MRI, look at the renal lesions. They are appearing white. Why is the lesion appearing white on T1? Because remember, fat is white on both T1 and T2. So fat is something which is T1 white. When I do a stir sequence for the same, what is a stir sequence? Stir is something which is fat suppressed sequence. It's a sequence in MRI which suppresses the fat. The fat appears dark. So this proves that this region is becoming dark on stir. That means this is fat containing. So again proves that कि ये जो T1 white है वो fat है. Right? So if it is suppressed on fat, it is fat containing. It is angiomyolipoma. ठीक है? Associated with tuberous sclerosis. Correct. What is this one here? This is the kidney. The renal lesion, gray color. What is gray? Uniformly gray. That is fluid containing. So what is this going to be? This is going to be a renal cyst. What classification do we use for that? Bosniak classification. A simple cyst like this which does not have any septae, any calcification, anything. It's a simple Bosniak grade 1, a benign renal cyst. Okay. And here what we are seeing is there's a renal lesion. This is kidney. This is the renal lesion here showing enhancement, showing necrotic areas. This is going to be RCC. Renal cell carcinoma will show necrotic areas and enhancement. There will be history of hematuria present there. Okay, this is RCC, right? Going to renal calcification, very, very important. Image A, image B, and image C. Again, this is something which is favorite for the exam. What is ABC here? What is ABC here? Yes? Very good. A is staghorn. Very good. Deepak has got it all correct. 3. A is the first one that you are seeing here. It is the staghorn appearance of the stone. This is staghorn calculus, which is generally associated with what infection? It is associated with Proteus. Okay, it is associated with Proteus. Next one, where you see bilateral calcification, so you are thinking of a metabolic endocrine condition. Bilateral agar dekha, so you think of medullary nephrocalcinosis. Medullary nephrocalcinosis, which shows this lucent areas in between, associated with what endocrine condition? किसमें calcium बढ़ जाता है? Endocrine hyperparathyroidism, increased calcium, so going in the kidney. That's how you remember. Okay, nephrocalcinosis, hyperparathyroidism. Next one where you are seeing is the pattern of calcification is this lobulated appearance of calcification. Generally, it is unilateral. It has this lobulated appearance. This is going to be putty kidney. Where do you see putty kidney? In TB. Okay, where do you see putty kidney? In TB. Right? So remember, this is how you differentiate the 3 important calcifications in kidney. Very, very important. Okay, very, very important. Correct. In the renal TB, there's going to be history of sterile pyuria. जब sterile pyuria की history आए, so then in that case, you should think of TB. Sterile pyuria is TB. Okay. Going to next one, again very frequently asked questions and images in your exam. First of all, tell me that what investigation is this one here? What is this investigation that you are seeing here in the image A? What investigation is that? Yes, this is a IVP image. This is not a plain X-ray. You are seeing the contrast in the kidney, in the ureter, and in the bladder. Okay? Do you see urethra in IVP? No, you do not see urethra in IVP. It is contrast X-ray of KUB, kidney, ureter, bladder. And what are you seeing here is, this is the right kidney that you are seeing. You are not seeing the right ureter. So, telling you that where is the obstruction? At the level of pelvic ureteric junction. Okay, so what is the diagnosis here? This is PUJ obstruction. The right kidney is hydronephrotic that you are seeing there. What will prove that it's a real obstruction? I have to take a delayed IVP image just to make sure that it is actually absent excretion into the ureter and not just delayed excretion. So in the question, they give you this history of delayed IVP image is taken. Okay, so that is PUJ obstruction. Look at this one. Is it a IVP image, guys? Is it IVP? Yes or no? Is this IVP here? Very good. This is MCU. How do you know that it's not a IVP? Because you are seeing the urethra here, right? In IVP, you do not see urethra. You can see the urethra here. You can see the bladder here. You can see the ureter and kidney also. So what is this? Basically, this is micturating cystourethrogram. The abnormality here is cystourethrogram should show bladder and urethra. You are seeing the ureter and the kidney, telling you that the urine, the contrast is refluxing back. So what is the diagnosis here? It is VUR. Vesico-ureteric reflux के लिए क्या investigation करोगे? MCU करोगे. And what is generally the history given in VUR? It is recurrent UTI in a child. Recurrent UTI in a child वाला history आया, VUR सोचना. अगर क्वेश्चन है कि VUR के वजह से जो किडनी में स्कारिंग हो रही है, वो देखने के लिए कौन सा इन्वेस्टिगेशन करेंगे? To look for scarring. Shabdeep, keyhole appearance that is seen in posterior urethral valve. Very good, correct. For the scarring, you will do DMSA scan, which is a nuclear scan which helps you see the scarring in the kidney. Okay, so DMSA scan is done for scar. If you want to prove there's a reflux, then you do MCU. Okay. Right, so this was a recent exam question. What are you seeing here? What is abnormal in the right kidney here? This is the dilated pelvis that you are seeing here, right? So this is how a PUJ obstruction will look on the CT. You will see this gray color is the fluid, basically the pelvis dilatation that you are seeing here. This is telling you there is hydronephrosis, right? The pelvic dilatation which is there, ये होगा PUJ, okay? This is PUJ in the CT. Going to the next one, what is this image showing? ये दो अलग images हैं. पहले ये IVP image में क्या लग रहा है आपको? What is this in the IVP, guys? What is abnormal here in the IVP? So if you look at the image very carefully, look at the kidney going medially, look at the kidney going medially towards the vertebra, like the two kidneys are joining hands, horseshoe kidney. Okay, this is horseshoe kidney. The same thing you are seeing here on the CT, this is horseshoe kidney, very important. Okay, this is horseshoe kidney on IVP and on CT. Okay. फ्लावर वाज अपीयरेंस बोलते हैं आईवीपी में, हैंडशेक अपीयरेंस बोलते हैं, जॉइनिंग हैंड्स अपीयरेंस बोलते हैं, राइट? हॉर्सशू किडनी इज वेरी फ्रीक्वेंटली आस्क्ड. Now coming to the neuroradiology, so that was about abdominal radiology जहाँ हमने hepatobiliary pancreas देखा, फिर हमने renal भी देखा, right? Now we'll go to some important neuroradiology images. This is one of the previous AIMS exam question. Tell me, what are you seeing here? What is this one here? Drooping lily sign, Deepak, remember droop is dupe. It is seen in duplication. Whether it's complete duplication, you have upper moiety or lower moiety kidney में होती है. So the upper moiety is basically pressing on the lower moiety. So the lower moiety droops down like a drooping lily. Drooping lily और fibrosis तो दो अलग चीजें हैं. Very good. Amazing, guys. So this is empty theca sign. See, this one here is the normal and this is abnormal. Look at the thecal sac, the CSF sac. It shows these black hypointense wali nerves. Normally, you should see the nerves like this. Here you are seeing that it is just the bright CSF. There are no nerves. So this is the empty theca sign or the empty thecal sac sign. Where is it seen? In arachnoiditis. Okay, arachnoiditis shows this empty theca sign. Why? Because of the arachnoid inflammation, it pulls the nerves towards itself. So all the nerves go in the periphery. That is why they are not seen into the CSF sac. So the theca appears empty. So it is arachnoiditis. Empty theca or empty thecal sac sign is arachnoiditis. Next one, what do you think is the diagnosis here? Yes. Correct. This is neurocysticercosis. You are seeing a cyst, right? A neurocyst, a cyst in the brain, right? Appearing like CSF जैसा और उसके अंदर एक डॉट है, मतलब सर्कोसिस है, स्कोलेक्स है. So this is neurocyst sarcosis, a neurocyst with a scolex with a dot. So cyst with dot like appearance. That is what you are seeing here, neurocysticercosis. When it gets calcified last stage में, it can show the starry sky appearance. What causes neurocysticercosis? Tinea solium, not Tinea saginata, it is Tinea solium. Okay, I'm coming to that. Now tell me, what are you seeing here? What is the diagnosis in this case? Yes. Right, this is TB. Where do you see the conglomerate lesion? Multiple tuberculomas have come together. The tuberculomas are peripherally enhancing. They have come together. You see the hydrocephalus, dilated ventricles. You see the meninges, the thick enhancing meninges telling you there is meningitis. And they have given you what investigation is this? MR spectroscopy. In the MR spectroscopy, towards the right side of the graph, you are seeing a peak. What peak is this? This is a lipid peak. So remember that TB mycobacterium has mycolipid. It shows the lipid peak. Okay. So lipid peak is seen in TB. Lipid peak will not be seen in neurocysticercosis. Remember, both of them can appear as ring enhancing lesion, be it neurocysticercosis, be it TB, or even like metastasis or maybe brain abscess. But if you see a lipid peak, that is TB. So MR spectroscopy helps you to identify that. The lipid peak is seen on the right side. ठीक है, 1 ppm के आसपास वो दिखता है. This is going to be TB. Okay, this is TB. Clear with everyone? Choline peak is seen in cancer. Right, because of the high cell turnover. कैंसर में सेल मल्टीप्लिकेशन हो रहे हैं, सेल टर्नओवर ज्यादा है, तो जो सेल मेम्ब्रेन में कोलिन है उसका पीक मिलता है कैंसर में. Brain tumor, primary brain tumor shows choline peak. ठीक है. And how do you identify brain abscess on MRI? Remember, like liver abscess, what pattern of enhancement will you see in brain abscess? There's going to be ring enhancement. It's a ring enhancing lesion with what pattern of restricted diffusion? What pattern of restricted diffusion? In the center of the brain abscess, there is thick pus. So that thick pus shows the restricted diffusion. Remember, there is central restricted diffusion on DWI. So this has been asked in one of the recent exam. Peripherally enhancing lesion with central restricted diffusion. It's a brain abscess. Okay, restriction hota hai beech mein. Coming to next one, very, very important. What is this? What are you seeing in this image here, guys? What congenital infection is this? Yes? Very good. Because this is calcification along the ventricle. This is periventricular calcification, hallmark of CMV. Periventricular calcification. Remember, CMV virus shows periventricular calcification. Very, very important. What image is this? What causative organism could be here in this infection? What lobe of the brain is this? This is temporal lobe. This is the basifrontal lobe. Right? So temporal lobe agar affect ho raha hai, temporal lobe encephalitis, it is HSV encephalitis. Very, very important. HSV encephalitis. Okay? Temporal lobe is HSV encephalitis. Kaun sa HSV? HSV1. Okay? Next one. In this image here, is this caput or is this cephal? Right? One of the NEET PG exam questions. ये caput है कि ये cephal hematoma है. How do you know this is cephal hematoma? It is not crossing the midline. It is showing this subperiosteal है, white line दिख रही है, उसके अंदर calcification हो सकता है, long standing होता है, right? So not crossing the sutures or midline, showing calcification present, showing like there is double skull जैसा sign है. This is cephal hematoma. Okay, this is cephal hematoma which stays for a longer duration of time. It can lead to jaundice because the blood का breakdown, right? तो वहाँ पे jaundice हो सकता है. This is cephal hematoma. Going to next one, what do you think is the diagnosis? First tell me what is the investigation which is shown here. What investigation is this? What investigation is this? Very good. This is DSA. If you see the black vessel like this, it's a DSA, digital subtraction angiogram. And what is the diagnosis, guys? Is it ICA aneurysm? Is it JNA, angiofibroma, caroticocavernous fistula, or AV malformation? What is this? Right, so I'm getting mixed answers here. This is carotico-cavernous fistula. This tortuous vessel that you are seeing here, this is the internal carotid artery, right? With the ICA angiogram, you are seeing the vein, right? The cavernous sinus, the ophthalmic vein, which is showing the enhancement, that is the contrast pickup. So that is telling you that कि artery के साथ what happened here, right? Artery के साथ अगर direct vein भी दिख रही है, so that is telling you there is a direct communication in between the two. It's a AV fistula. Fistula shows an early draining vein. Okay, fistula shows an early draining vein. If it was ICA aneurysm, you will see a blob of contrast ऐसा दिखेगा. ठीक है, JNA में क्या दिखेगा? Tumor blush दिखेगा. Okay, you will see a lot of contrast in that area. AV malformation is something which shows a nidus, abnormal entanglement of vessels, which shows the bag of worm जैसा appearance दिखेगा, nidus दिखेगा in AV malformation. So this is carotico-cavernous fistula. Okay. Now look at this one. What is this MRI image showing basically here? So this is the ophthalmic vein which is prominent on one side, telling you that it's a high pressure on that side coming from the cavernous sinus. It is because of the carotico-cavernous fistula, right? Prominent superior ophthalmic vein will be seen. Carotico-cavernous fistula can be seen post-trauma. The history there will be of pulsatile proptosis. Pulsatile proptosis. So pulsatile proptosis post-trauma, prominent superior ophthalmic vein, it is carotico-cavernous fistula. Okay, carotico-cavernous fistula. Okay. Next one, right? Again a NEET PG exam question. What is this? Thank you, Sanket. क्लासिकली जब आपको ये पोजीशन में ऐसे प्रोमिनेंट यहाँ पे दिख रहा है एक वेसल ड्रेनिंग इनटू द स्ट्रेट साइनस, यहाँ पे कॉर्पस कैलोजम के नीचे आ रहा है ड्रेनिंग इनटू द स्ट्रेट साइनस, दिस इज द क्लासिकल इमेज ऑफ vein of Galen malformation, which is again an AV fistula, right? The classical history will be a newborn, a neonate with hydrocephalus, plus there is heart failure. Okay, hydrocephalus plus heart failure in a neonate is classical of vein of Galen malformation. Okay, vein of Galen malformation. Okay, next one. This is a DSA that you are seeing here. क्या दिख रहा है ये DSA में? What is this one here? See, the tortuous is the internal carotid artery dividing into बीच में ACA और laterally जाने वाला MCA. ठीक है, तो यहाँ पे क्या दिख रहा है? यहाँ पे aneurysm दिख रहा है in the ACA. Okay, there is aneurysm that you are seeing. A blob of contrast which has gone into the aneurysm, ACA aneurysm, and because of that you can see this subarachnoid hemorrhage, right? The blood accumulating in the interhemispheric fissure. This is because of the aneurysm, there is subarachnoid hemorrhage. ठीक है? What is this one here? ये है जो हम abnormal nidus की बात कर रहे थे. ठीक है, ऐसा दिखेगा nidus. This is on MRI, the prominent flow voids, all this as a tortuous bag of worm appearance. Okay, the bag of worm appearance, the nidus, this is AV malformation. Okay, remember AV malformation has this nidus. AV fistula has a direct connection between artery and vein. Okay, so this is AV malformation. Thank you, Anvish. Thank you, Dr. D. Vicky, for reminding me. Chalo. So I hope this is clear with everyone. So we are done with neuroradiology, guys. A quick thumbs up if you are still there and the Josh is still high. Right, we are towards the last lap of this session. We have musculoskeletal and OBGY coming up next. Puff of smoke is seen in Moya Moya. Right, so what you see there is, so the puff of smoke is basically from those collaterals, the contrast is going out. So you will see the contrast which is going out, you know, like the smoke coming out. The contrast is not seen only in the vessel but outside the vessel as well. Look at an image, you will get the idea. Moya Moya mein dikhega. Okay, great. Going on to musculoskeletal, guys, what is the diagnosis here? Oh, Ashwada is here too. Very good. This is hyperparathyroidism. Hyperparathyroidism. How do we know that? Look at the resorption occurring, the subperiosteal resorption, right? It starts in the middle phalanx classically. तो hand X-ray पे पहले दिखता है. This is classical of hyperparathyroidism. Okay, the subperiosteal bone resorption. Subperiosteal bone resorption is classical of hyperparathyroidism. Okay, going to next one. What is the diagnosis here? Yes, you see brown tumor in primary more common. Rugger-Jersey is seen in secondary hyperparathyroid, the renal osteodystrophy. Very good. This is TB spine that you are seeing here, the two vertebra involved. Most important, what you see here, intervertebral disc is involved, intervertebral disc, adjacent vertebra involved. This is Pott spine, that is TB spine. Okay, this is Pott spine, that is TB spine. Very, very important. It involves the disc. The paradiscal involvement is very common. Next one, when you see these terms like sequestrum, involucrum, what pathology are you thinking about? Chronic osteomyelitis. The patient comes with discharging sinus. ठीक है, एक साइनस बन गया है जिसमें से डेड बोन फ्रेगमेंट्स बाहर आ रहे हैं, डिस्चार्जिंग साइनस की हिस्ट्री होगी. व्हाट इज सीक्वेस्ट्रम? Sequestrum is the dead bone sequestered inside. Okay, does it appear white or does it appear black? Remember, the dead bone is radio opaque. It appears white. So the dead bone in the center is going to be sequestrum. Involucrum is the surrounding, the healing occurring, the periosteal reaction. Cloaca is the opening in the bone. Okay, cloaca is the opening in the bone, right? So look at how in chronic osteomyelitis the bone appears very shaggy, right? A shaggy bone is what you see there. Dead bone is white, correct. Next one, what do you think is the diagnosis here in this case? Chronic osteomyelitis, okay, osteoarthritis 9. What is this? Yes, medical cake, correct. This is ankylosing spondylitis. Okay, ankylosing spondylitis. Okay, ankylosing spondylitis. Why? Can you see this white line in the center? Right, look at the white line in the center. That is the dagger sign that you are seeing, the ossification of the interspinous ligaments happening there. There is fusion of the SI joints which happens. Ankspond starts in the SI joint, the sacroiliac joint, right? Sacroiliitis hota hai. Dagger sign dikhegi. This is ankylosing spondylitis. Okay, very, very important. Coming to OBGY, इसमें मुझे बताओ क्या दिख रहा है favorite for the exam. This is where you are not seeing the white appearing the skull bone. This is anencephaly, right? And look at the appearance here. Look at the appearance here. You are not seeing the above part here. This is frog eye sign seen in anencephaly. Okay, anencephaly, frog eye sign. We need to do MTP. Folic acid is not going to help now. Okay. What is the diagnosis here in image A and image B? Image A and image B, इसमें क्या है diagnosis? Deepak, anencephaly can be seen at 10 to 11 weeks, right? बाकी anomalies के लिए हम 18 to 20 weeks पे करते हैं, ये बहुत जल्दी 10 to 11 weeks पे ही हो जाना चाहिए. A is omphalocele and B is, how do you differentiate omphalocele versus gastroschisis? Remember omphalocele. Omphalo means the cord वाला. So omphalocele में omphalo cord साथ में जाता है, ठीक है? And remember it is MP. That means it has membrane present. Okay, sac present, उसका membrane होता है. So what you are seeing here is there's something coming out. Along with that, उसमें ये जो black दिख रहा है ये cord है. तो ये जो बाहर आ रहा है उसके साथ if you are seeing the cord is also present along with that, this is going to be omphalocele. While gastroschisis is something which is adjacent to the cord. It is not in the midline. If in the midline there is cord, paramedian position में आता है. So what you see here is the black one here is the cord, and adjacent to the cord you are seeing the herniation happening there. So this is what is going to be gastroschisis, which is in the gastroschisis. Next one, banana sign. INI-CET exam question. Where do you see banana sign? Spina bifida has banana sign, right? What is the banana sign? So like a banana, you see the curving of the cerebellum. With spina bifida, the pull on the brain structures also happening. So there is the cerebellum which becomes curved. Okay, the curved cerebellum is what is called as banana sign. What is the other sign in spina bifida? The concave frontal bones, that is called as lemon sign. Okay. So remember, neural tube defect, spina bifida, it gives lemon sign and banana sign. Okay, lemon sign and banana sign. Correct. What are you seeing here in this image? What are you seeing here in this image? In early pregnancy. What is this? Very good. You can see two circles here. This is the double bleb sign. Okay, what are you seeing here? This is the double bleb sign, the two circles that you are seeing there. What forms the double bleb? Very good. Right, what is the one structure and the second structure? One is the amnion and second is the yolk sac. Okay, the two structures forming the double bleb are the yolk sac and the amnion. Okay, what is this outer structure called as? What is this? This is the gestational sac. जिसके अंदर सब कुछ डेवलप हो रहा है, that is the gestational sac. This is the amnion surrounding the, if you see there's a very small embryonic, the fetal pole inside, and surrounding that is the amnion. Okay, so you have the yolk sac and you have the amnion forming double bleb. Important. What is this one here? If this is a female coming with history of irregular bleeding, metrorrhagia हो रहा है, ध्वनि, ये जब amnion और yolk sac दिखता है ना, like 5 weeks के around, you will see this double bleb sign. It's a normal sign. Adenomyosis में, you will see a uterus which is very bulky and heterogeneous, right? Very good. This is not ring of fire. Remember, any orange color here is not going to be ring of fire. This is a Doppler image showing a vessel which is going into the endometrium में कुछ lesion है, उसके अंदर ये vessel जा रहा है. This is the feeding vessel sign. Feeding vessel sign which is seen in endometrial polyp. Okay, a polyp, remember how is the polyp? Polyp ऐसा होता है और उसमें एक feed करने वाला vessel होता है. So feeding vessel sign is seen in endometrial polyp. Ring of fire will actually look like a ring. Okay, so that is what is seen in ectopic, ring of fire. This is not a ring. This is feeding vessel sign, endometrial polyp. Okay, endometrial polyp. Correct. Coming to the last part, the nuclear medicine radiotherapy. Tell me few tumors which are PET negative. They are tumors, but still on PET they can appear negative. What are those? This is also your previous AIMS exam question. Yes, Dr. D. Becky, right? देखो, ring of fire एक ruptured corpus luteum में भी दिख सकता है. Corpus luteum cyst या corpus luteum जो rupture हुआ है उसमें भी दिख सकता है. नहीं, it is typical carcinoid कि atypical carcinoid. I see mixed, कोई बोल रहा है typical, कोई बोल रहा है atypical. See, the concept here is what tumor will show PET negative is a tumor which is like a normal epithelium, and that is why it is not able to be different from the normal epithelium. So low grade tumors or differentiated, well differentiated tumors are the ones which are going to be PET negative. So low grade tumor in the lung, like the low grade adenocarcinoma in situ बोलते हैं अभी जिसको, which is bronchoalveolar carcinoma, which is a low grade tumor. Then carcinoid. Even in carcinoid, remember a typical carcinoid. Typical matlab well differentiated carcinoid. That is going to be PET negative. Normal physiological kahan increased uptake dikhta hai in PET? Remember the supraclavicular areas, they can show increased uptake, right? Because of the brown adipose tissue, right? They can show increased uptake. ठीक है? Yes. Acute radiation syndrome is seen when the dose is more than 1 to 2 gray. Okay, 1 to 2 gray acute, इतना ज्यादा रेडिएशन मिला है तो acute radiation syndrome होता है. सबसे पहले क्या अफेक्ट होता है? रेडियो सेंसिटिव वाला पहले होगा हेमाटोपोइटिक, राइट, फिर आएगा जीआईटी और फिर आएगा सीएनएस, लास्ट में आएगा न्यूरो, राइट. न्यूरो इज समथिंग विच इज लाइक मोर रेडियो रेजिस्टेंट वाला. सो रिमेंबर सबसे पहले होगा बोन मैरो सप्रेशन. ओके, बोन मैरो सप्रेशन. Recent FMGE exam question, PSMA scan is done for, what is PSMA scan done for? So PSMA is prostate specific membrane antigen. So remember this is done for prostate. Okay, P for prostate. PSMA is done for prostate. Remember that. Okay. Which is the most radio resistant and most radio sensitive tissue? Most radio resistant is the neurons. Most radio sensitive, जैसे अभी एक FMG एग्जाम में क्वेश्चन आया था, ऑप्शंस था, गोनाड्स भी था और बोन भी था. So when they don't specifically mention bone marrow, remember gonads are more sensitive, right? Gonads or bone में specifically the bone marrow which is sensitive, not the cortex, right? The marrow which is more sensitive. Okay, right. Going to next one, Bragg peak. What is Bragg peak seen with? In radiotherapy, we talk about Bragg peak. This is your PYQ of NEET PG exam. What is Bragg peak seen with? Yes, very good. Remember, Bragg BR is seen with PR, that is proton. The concept here is when you give proton beam for radiotherapy, proton is like a very targeted therapy, right? So it will go and affect the tumor and the surrounding tissue will not be that much affected. So it goes एकदम आराम से into the body. फिर जैसे ही tumor आएगा, suddenly उसको बहुत सारा radiation देगा. So that is what is the peak seen at the tumor site. Okay. So it is like a pencil beam directed therapy, and that is why we prefer proton beam when you want to do in a child. You want to give, especially अगर brain tumor है, उसमें रेडियोथेरेपी देना है तो उसमें हम प्रोटॉन बीम प्रेफर करते हैं, राइट. मिनिमल डैमेज करेगा प्रोटॉन बीम. करेक्ट. व्हाट इन्वेस्टिगेशन शुड यू डू बिफोर गिविंग आईवी कॉन्ट्रास्ट? व्हाट इन्वेस्टिगेशन इज डन बिफोर गिविंग आईवी कॉन्ट्रास्ट? KFT और RFT, किडनी फंक्शन टेस्ट, राइट. सीरम क्रिएटिनिन हमें चेक करना होता है, वेरी वेरी इंपॉर्टेंट. सीरम क्रिएटिनिन चेक करके फिर ही कॉन्ट्रास्ट देना होता है, because it shows renal excretion of the contrast. Serum creatinine needs to be checked. Whenever you are doing CT in a female, what should you always ask for? LMP, right? So this is what we used to do as residents. अगर बिना LMP पूछ के कोई फीमेल में अगर CT किया, right? So बहुत हमें झाप पड़ती थी. So asking LMP before doing CT in female is very very important because CT has radiation. You cannot do CT in pregnant females, right? So that is why LMP पूछना बहुत ज़रूरी है, ठीक है? LMP पूछना बहुत ज़रूरी है, right? So I think yes, that was about the today's session, guys, focusing on the questions and the topics which are very very frequently asked in your exam, right? हाँ हुआ है मेरे से, like बहुत गलतियाँ कर चुकी मैं मेरी रेसिडेंसी में, right? To err is human. So I'm a human at the end, right? So गलतियाँ तो हमने भी की है. So yes, guys, that was about a quick session revising the most important, the most frequently asked images in radiology. Right? All of this will make more sense, you know, if you have your basics of radiology cleared. So you have to, of course, supplement this with the primary videos, maybe the main videos or rapid revision videos on the PrepLadder app. This is like your last minute revision. अगर कुछ करना है, राइट, अभी पढ़ लिया, कुछ लास्ट मिनट में क्या रिवाइज करना है तो आप ये रिवाइज कर सकते हो, ठीक है. Right. Thank you so much everyone for all the love that I can see in the comments. Thank you so much. And thank you, Avnish. To be very honest, it was a very unplanned and impromptu one, but I'm grateful that we could pull it off. Anything specific for INI-CET? Nothing like that. Majority of your radiology is covered in the other subjects. But we have definitely seen that, radiology mein thode se eccentric images aate hain. That's why I said that if your black and white of radiology is clear, so that even if you get a new image in the exam, you are able to decode it, you are good to go. Oh, Anvish. Sorry, Anvish. Natasha, dekho, definitely RR, LRR will not have all the content, right? So primarily agar pura cover karna hai, to RR. Curly lines, Khushi, curly lines, curly B lines specifically, if I talk about B at the base, you will see the short horizontal lines at the base like this. Okay, the short horizontal lines, they indicate pulmonary edema. It's interstitial edema. Okay, any other queries, guys? Thank you so much. All right, I think that's done. And no matter what, we are always there, right? If you have any queries, you can always reach out to us. So thank you so much, everyone, for joining in. Goodbye, take care, and keep studying, keep revising, and keep winning. And of course, not to forget about the INI-CET Champions exam, which is live from 23rd to 27th April. Please give that so that, it gives you a good assessment of your preparation as well. Thank you again and see you soon. Thank you.